Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Thursday, May 7th. In the 5 counties, today we are reporting 2,895 people have tested positive for COVID-19. We didn't have yesterday's numbers, so it's hard to report the percentage increase, but we think it's about 2 or 3% per day.
It has been that level, Dennis, yes.
Great news, inside here in the medical center, the number of people that we're currently treating for COVID-19 is 48. That's the first time we've been under 50 in quite some time. We have 35 on the floor, we have 13 in the ICU, and I believe we have 6 on ventilators.
Yes.
Interestingly, yesterday we discharged 7 people and we only admitted 1. So numbers are definitely moving in the right direction.
Absolutely.
Speaking of numbers, we received a comment yesterday from Dr. Anderson. He's one of our brilliant scientists here, and he suggested that we might want to graphically display some of the data that we've been speaking about to provide some context. So let's pop the graph up on the screen while Fred and I talk through this. As we look at this graph on the horizontal axis, this takes us from March 8th all the way through yesterday. So each metric there is a day. Above the horizontal line, you'll see blue bars. Each one of those represents admissions to the hospital on that day. And you can see that there's a vertical line on the left-hand side that shows admissions or discharges on that day. So if the bar goes up by 2, that means 2 admissions on that day. And those are in blue. There's also orange bars that go above those lines, and those represent transfers from New York City. So if you're above the line, you either came in from the region, you're blue, or you came in from New York City and you're orange. Below the line are people who have left the hospital. If you're green, then you've been discharged safely to home. And if you're dark gray, then unfortunately that represents a death inside the organization. The last line is a purple line, and that is actually the scale for that is on the right-hand side. And that represents the total number of people in the hospital on that day with COVID-19. And you can see how that graph went up and how it's trending down. So Fred, let me throw it over to you. What are some of the things that are jumping out to you on this graph?
So a couple of things, Dennis. If you just focus on the purple line, you can see after somewhere in the beginning of April, around April 6th or 7th, that line has come down from its peak at about 80 down to, as you said today, 48. So that's a good trend down. If you look at the blue bars, again, over that same time frame, it's kind of been static. A little up and down day over day, but no real trend there, so kind of flat. And then if you look at the green bars, you can see that we've had periods of time with lots of discharges, fewer, and then more as you move out into late April and May. This is all very positive, very, very positive.
Also positive is the fact that from concept to production, this took us about 4 hours to make because of the great work of Matt Cerf, Mike Hauk, and Mike Hamilton. So thank you for our analytics team for putting this together. And I think, Fred, your idea is let's share this with everybody.
Yeah, we're going to post this on the intranet, updated every day, or I should say Matt and Mike are going to update it every day, and it'll be there for people to follow.
Yeah. And thank you to Dr. Anderson for that recommendation. Fred, you mentioned that you were going to participate in the Journal Club last night. It was going to be focused on respiratory therapy from nasal cannula all the way through ventilation. What did you learn?
So first of all, Dennis, it was very interesting. The 2 learners who did the research did a tremendous job presenting the information. And then the 2 people discussing it, Dr. Craig Wu and Dr. David Pallett, did a terrific job discussing. I would summarize it by saying there seem to be 2 different types of lung injury. They have different profiles, and they probably need to be treated a little bit differently on a ventilator. There isn't a lot of consensus yet because we're still early in learning on how to treat this disease, but it was very, very thoughtful, very thorough discussion of lung injury and how to treat it.
Right. And I'm sure there'll be another Journal Club next week, we'll bring back that information.
We'll talk about it again.
We wanted to save the remaining time today to talk about the process of applying for the waiver in order to start doing elective cases, otherwise known as medically necessary procedures. Fred, what's the update?
So last night about 9 o'clock, I received an email in my inbox with a letter giving us approval to start elective, or what we call medically necessary procedures. So we are planning to start on Monday at our South Clinical campus. A number of people, I said, have been hard at work coming up with a plan. That's this sheet of 10 or 12 pages here. That they've developed that's going to be implemented at South Clinical. We're going to start with small cases, less than 60 minutes of operative time, cases that don't likely need to be intubated, have very little likelihood of blood loss that would need to be replaced, or need to be hospitalized after the procedure. This work, putting this all together, is the product of Rich Ewell, Sharon Bessel, and Stephanie Jones, one of our orthopedic surgeons, our VP for nursing services, perioperative nursing services, and our new chair of anesthesia. We're very confident that we're going to be able to do this safely for our patients. Our South Clinical campus is a mile away from the main campus, really completely, fully contained. There'll be a separate entrance for patients to go in. Patients need to be tested and need to be negative for COVID before they can have their surgical procedure. So all patients who get surgery there will be negative for the disease. Over time, we will increase the capacity. We'll do more complex cases. That's all detailed in these documents, how we will ramp up over time. We feel this is going to have absolutely no impact on our ability on this campus to provide for the more serious illness that we provide for on this campus, as well as the COVID patients and any surge that might happen.
We have mentioned that this is an advocacy issue for the health of people in the capital region. Let's talk a little bit about that. The number of backlog cases that we've had to put on pause over the last approximate 1.5 to 2 months waiting to start doing this again is actually just slightly more than 6,000 cases. That gives you some context as to how many people have been waiting to access care just on this campus. So incredible thanks to those who worked on that. We have several statewide elected officials, Pat Fahey, John McDonald, and Neil Breslin, who advocated for us. We thank them sincerely. On this campus, I want to put out my sincere thanks to John Reagan, Kara Richdorf, and particularly to you, Fred, who really spearheaded this effort. I mean, it's incredible that you got us this far. Thank you very much.
Thank you.
Yeah, that's very good. So hopefully we'll hear some more about that in the next couple of days, but we're excited to get started for the people in this region.
It's going to be very important for our patients.
And to that point, we are wearing shirts today representing elective orthopedic surgery. And we're proud to wear this shirt. This is a population that has been waiting to have the care of our doctors, our anesthesiologists, our nurses, and starting next week, we're going to start it up again. So very good.
Yes.
Okay. There was a question that was asked about Kawasaki's disease, which is something that we see in children, and we've been asked to speak about that. We've spoken to our pediatric rheumatologists and our pediatric infectious disease doctors. We're going to give a little bit more of a detailed answer on that tomorrow.
Yes. And Dennis, it's still Nurse Appreciation Week.
That's right.
And there are 2 more pillars of nursing that have been awarded that very, very prestigious distinction. Kathleen Ryan Purcell from the HIV clinic in the Department of Medicine. Shout out to Kathleen, tremendous job.
Absolutely. And Doreen Schrenk, who I think is recently retired.
Absolutely.
But had a long, distinguished career here in interventional radiology.
Yes.
So
we actually went to her home to give her her award.
Yeah.
Yeah.
So fantastic. Great. So 6 pillars.
6 pillars.
And we're very proud of our nurses. Tomorrow's Friday. We usually end with some good news, and we'll do that again tomorrow. That should do it. We look forward to coming back tomorrow. We ask that you please take care of yourself, take care of each other, and we will see you tomorrow.